So here's what they said, is beginning periodontal disease, they said greater than 4, less than 5, so we're going to translate this to 4 millimeter pocket depths, okay, bleeding, and some attachment loss. Okay, moderate is now we're 5 to 6 millimeters, bleeding, more attachment loss. And then advanced is 7+ millimeters, bleeding, and then we're getting into, we have severe attachment loss. Okay? So it's important for us, this is the first part of that system to get your team consistent, right? We see X, then next is you decide what you're going to do when you see that, right? And what are all the different layers of this diagnosis, right? The x-rays, the risk factors, the medical history, the past history, what are all the different things that we look at? You can find this update, this is the resource for the update. If you go onto AAP's website, perio.org, you go to publications. You feel free to take a picture too if you need to of any of the slides. AAP clinical and scientific papers, and then you'll see it here. It's this task force update. So it's actually quite interesting. And then the other thing that they look at is they say we also have to look at is this chronic disease or could this possibly be aggressive disease, right? And they say if we're seeing deposits that are consistent with the amount of disease, with the level of disease, then it's probably chronic perio. If the hard and soft deposits are inconsistent with the level of disease we're seeing, then it could be aggressive periodontal disease. So what that means is calculus doesn't always equal perio, and perio doesn't always equal calculus. We got to look at the whole big picture, right?